I am the change.
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 The accelerated care and treatment for mothers and newborn, it is a project which is implemented by VSO, and the project aims at accelerating the reduction of maternal and neonatal mortality in southern Tanzania, which includes Lindi and Mtwara region. The project is based on simple innovations and low-cost technology, which includes the establishment of neonatal care, neonatal intensive care units at the district hospital level, but also it involves capacity building of healthcare workers to ensure that healthcare workers are able to assess, to treat, to make treatment for the newborns, to make treatment for most of the maternal obstetric conditions. And also the project aims at supplying the medical equipment which are important and necessary for maternal and newborn care. But also the project aims at using newborn triage checklist, which is a simple checklist used by healthcare workers to assess the newborn in 24 hours after birth.
The regions of Lindi and Mtwara were facing the high rate of neonatal and maternal mortality. This really informed highly on the design of the project. At the same time, there was a lack of knowledge amongst the community on the health services that the facilities in their own regions would offer to avert these challenges. The unusual elements about this project funded by HDIF are two. One is the innovation. Innovation in the sense that VSO is not working independently in the region of Lindi and Mtwara. We have a number of partners. One of those partners we are working with is GE, which is General Electric. This is an American company which brought in innovation, which is called VScan. A VScan is a portable ultrasound machine that helps to screen pregnant mothers and determine the health of their own bodies and the health of their own fetus in their wombs. But the second partners that we have in the project is the Ifakara Health Institute. Their work is to become critical partners or critical friends who would say, support us and give us constructive criticism on the project and its direction. The other partner that we work with is the Regional Health Management Team. In short, they are called the RHMTs. And the work of RHMT really is to coordinate all the work that we do and give us guidelines on the policies and protocols that the Ministry of Health at the central level would like us to follow in the course of implementation.
With the introduction of the VScan, the notion of birth preparedness has been more visible. It's easy to know the status of their infants. Sometimes if they can be diagnosed with anything, so it's easy for them to know what I'm expecting.
Ile kadi ya NTC kadi imetusaidia sana. Kwanza imetusaidia kugundua matatizo ya watoto kwa mapema zaidi na pia ufuatiliaji wa watoto kwa ndani ya masaa 24 mpaka 48. Kwa hiyo imetusaidia kuwagundua watoto ambao wanaumwa kwa haraka zaidi. Mtoto akiwa kwenye rangi ya nyekundu ni mtoto huyo ambaye anaumwa, inatakiwa aende moja kwa moja NICU. Na mtoto ambaye yuko kwenye rangi ya njano, ina maana mtoto huyo anakuwa yuko kwenye uangalizi, anatakiwa akae hospitalini ndani ya masaa 48. Na mtoto ambaye atakuwa yupo kwenye kijani, huyo ni mtoto ambaye yuko sawa tu, atakaa tu kwenye uangalizi kwa muda wa masaa 24, ataruhusiwa ataenda nyumbani.
The beneficiaries of this project are in 3 categories. First, we have pregnant women and mothers of the newborn. They benefit from the improved quality maternal services offered by our facilities. Then there is neonates. So these are the babies from 0 to 28 days, and they benefit from our services, particularly the NICU from the services offered by trained staff, so they are able to access quality of care.
Mtoto wangu alizaliwa akiwa na uzito mdogo, hajatimiza miezi na alikuwa ni mdogo kweli. Lakini nashukuru baada ya kupokelewa mtoto kahudumiwa vizuri.
Kutokana na matunzo ambayo alikuwa anapatiwa hapa, hakukuwa develop na tatizo jingine lolote ambalo liliweza kusema kwamba litutie hofu zaidi. Kwa mpaka leo anakula vizuri, anacheza vizuri. Bila kuwa na vifaa ilikuwa ni changamoto. Sababu mtoto alikaa kwenye oxygen machine karibu wiki mbili. Pale kwenye homing bag amekaa karibu wiki mbili pia. Kwa hiyo yani kama visinge kuwepo, sidhani kama saizi ningekuwa na beba hivi mtoto.
Most of our staff, when finishing their training, formal training from the colleges, they don't have much knowledge on caring of the neonates. But HCT supported us in training, first of all, training in terms of caring of the babies, caring even the pregnant mothers. HCT helps us also on providing those medical equipment like oxygen machines, penguin sucker, which are very important for the resuscitation of the neonates, also baby warmers.
Sasa hivi naweza nikafanya kazi kwa uhuru hata kama nikimpata yule mtoto ni tofauti na maana. Sababu mwanzo anaweza ukaja mtoto yule unahangaika jinsi ya kumhudumia mtoto kulingana na vifaa havipo. Lakini kwa sasa hivi kulingana na vifaa vipo, unajua kwamba nichukue kifaa hiki nimfanyie hivi na nichukue kile pale nimfanyie hivi.
The project has a positive impact on the lives of women. For example, if I could cite an example from the VScan, these are services which before was not available in the hospital. Now they can get the services in the hospitals where they are. So this has enabled the women at least to save some medical costs. Yeah, instead of traveling far away to get the services, now they can get the hospitals and the services.
There has facilities which are benefited with this accelerated care project. For Lindi is 1 regional referral hospital and 5 district hospital. For Mtwara is 1 regional referral hospital and 3 district hospital.
I have learned that strong partnership is important in project implementation. So VSO, like other donors, we have been having a very strong partnership, trying to involve our partners and the other stakeholders in the project. And that is one way of making sure that our project is sustainable. And also to promote what we call acceptability of the project.
If we can expand to the health centers, hoping that most of health care workers knows what the meaning of this project, it will help a lot. I'm not saying that the whole region, every health facility, but at least going slowly to the areas where CMOC, there is a comprehensive emergency obstetric care, where the same activities done in the hospital level, they are also being done.
Leo hii bila kuwepo hii huduma, mimi nisingekuwa naitwa mama tena, yani kupitia mtoto huyu. Lakini huduma imesaidia kwa kiasi kikubwa sana. Na kama kweli serikali ina uwezo kufanya hii huduma au watu wana uwezo kusaidia hivi, ingekuwa vizuri wakasaidia kila sehemu. Sababu wataokoa maisha ya watoto wetu na si wa mama pia tutapata faraja. Kama sasa hizi nafarijika, yani nasahau kama mwanangu alikuwa premature.
So imagine you're pregnant and you're not going to learn anything about the health of your baby or your own health until the moment you go into labor. So one of the things that HDIF's partnership with VSO is doing is introducing portable V-scans or ultrasound machines even at the district hospital level so that women can be scanned and know health problems and take preventative care before delivery of their child. The second, in addition to extending that service through the V-scan, is introducing NIC ICUs, which are low cost, so really scaled down neonatal intensive care units in case there are complications in delivery to take care of the child as close to the point of delivery as possible. We know that a referral and a 2-hour car ride is not going to be healthy for a baby who's really suffering at delivery. By combining these things with a training package, VSO is able to create a total package for neonatal care that hasn't been introduced in the country.